Picture this. Every single month for years, you deal with pain so severe it stops you from going to work, and every doctor you see tells you that is just what periods are like. For an estimated 1 in 10 women of reproductive age around the world, that is not an exaggeration. It is Tuesday. The condition is called endometriosis, and it happens when tissue similar to the lining of the uterus starts growing in places it was never supposed to be, on the ovaries, the fallopian tubes, the pelvic wall, sometimes even the bowel. Have you ever been told that period pain is just something you have to push through? For decades, that was basically the official medical answer. Severe menstrual pain got waved off as normal, something to manage with a heating pad and enough ibuprofen. That attitude has a real cost. On average, it takes 4 to 11 years for endometriosis to actually get diagnosed, even in countries with excellent access to healthcare. Part of the problem is that the symptoms overlap with a dozen other conditions: irritable bowel syndrome, ovarian cysts, pelvic infections. So for years the pain just gets filed under bad periods. There is also a more uncomfortable reason. For most of modern medical history, severe pain in women was routinely dismissed or downplayed by doctors, chalked up to stress, anxiety, or simply having a low pain tolerance. And even once endometriosis is suspected, confirming it has traditionally required actual surgery. For decades, a laparoscopy, cutting into the abdomen to look directly at the tissue, was the only truly definitive way to diagnose it. And this is not some rare niche condition. In the United States alone, endometriosis is estimated to cost the economy $78 billion a year in healthcare spending and lost work. That number sits right up there with far more publicly discussed chronic diseases, yet most people could not tell you what endometriosis actually is. So where does this misplaced tissue actually come from in the first place? The leading explanation goes back almost a century, to an American gynecologist named John Sampson, who proposed what is now called retrograde menstruation. The idea is that instead of leaving the body entirely, some menstrual blood flows backward, through the fallopian tubes and into the pelvis, where fragments of tissue can implant and grow. When that tissue implants on the ovaries, it can fill with old, trapped blood over time and darken to what doctors nickname chocolate cysts, a strangely domestic name for something that causes so much pain. Here is the strange part. Most women actually experience some degree of that backward flow, but only about 1 in 10 go on to develop endometriosis. So something else has to explain why some women's bodies handle that stray tissue just fine, while others end up with a disease that spreads, inflames, and causes years of pain. Increasingly, the answer researchers point to is the immune system, and specifically a process called oxidative stress. Think of it like this. Inside your cells, unstable molecules are constantly being produced, almost like tiny sparks, that damage whatever they touch if left unchecked. Your body normally has its own fire suppression system for this, a network of antioxidant defenses that neutralize those sparks before they cause real damage. In women with endometriosis, fluid inside the pelvis shows unusually high levels of inflammatory signals, and immune cells called macrophages appear to be switched into overdrive. Researchers have also found that women with endometriosis tend to have lower levels of vitamins A, C, and E circulating in their blood compared to women without the disease, as if their antioxidant reserves are already running low. That combination, sparks flying and not enough suppression, is now thought to be a major driver of the chronic pain itself, not just a side effect of the disease. Which raises an obvious question. If the problem is too much oxidative damage and not enough antioxidant defense, what happens if someone simply adds more antioxidants to the mix? This is not a new idea. Humans have been stumbling onto antioxidant vitamins by accident for centuries, usually by getting desperately sick without them first. In 1747, a Scottish naval surgeon named James Lind ran what is considered one of the first controlled clinical trials in history, testing citrus fruit on sailors dying of scurvy. Nobody knew what vitamin C actually was yet. Lin just knew the sailors who got oranges and lemons recovered, and the ones who did not kept getting sicker. Vitamin E took even longer to pin down. It was not identified until the 1920s by researchers Herbert Evans and Catherine Bishop, who noticed that rats on a certain diet could not reproduce. Whatever the missing compound was, it turned out to be hiding in lettuce and wheat germ, and they eventually named it tocopherol, from a Greek phrase that roughly means to bear offspring. There is a strange bit of irony in that. A vitamin discovered because of its link to fertility is now being tested for a disease that can itself cause infertility. Vitamin research has not always lived up to the hype either. Plenty of large trials on multivitamins and heart disease or cancer prevention ended up disappointing, so scientists have learned to stay cautious. But endometriosis has a few smaller, curious data points worth mentioning. Some studies have linked garlic extract to reduced pelvic pain, thanks to its own antioxidant and anti-inflammatory compounds. Other research has connected a higher intake of fruit, and citrus fruit specifically, with a lower risk of developing endometriosis in the first place. Animal and human studies alike have shown that eating more fruit and vegetables can lower markers of oxidative stress in the body. So here's a question worth sitting with for a second. If eating more citrus fruit is already linked to a lower risk of a disease that affects 1 in 10 women, could something as simple as a vitamin capsule actually help once someone already has it? It is worth remembering that endometriosis pain is not just one thing. Some of it is inflammatory, driven by hormone-like compounds called prostaglandins that trigger cramping. Some of it is neuropathic, meaning the nerves themselves become sensitized over time, which is part of why the pain can persist even after lesions are surgically removed. Current treatment options reflect just how messy this disease is to manage. Hormonal birth control and drugs that suppress estrogen can help, but they come with their own side effects. Surgery to remove the misplaced tissue is another option, and for some women it brings real relief, but the tissue has a frustrating habit of growing back. Given all of that, it is easy to see why researchers wanted a clear answer on something as simple, cheap, and low risk as antioxidant vitamins. So a team of researchers set out to gather every relevant clinical trial ever run on the subject and pool the results together, something that, remarkably, had never actually been done before for this specific question. So after digging through thousands of medical records and years of scattered research, what did the numbers actually show about vitamins and endometriosis pain? The team searched 5 major databases: PubMed, Web of Science, the Cochrane Library, Scopus, and China's CNKI, for every relevant study published through March 2023. After screening 4,420 records and following strict PRISMA reporting guidelines under a protocol registered in advance, 13 randomized controlled trials made the final cut, covering 589 patients. Those patients came from 6 different countries: Iran, China, Mexico, Egypt, Germany, and the United States, testing doses of vitamin C, vitamin E, and vitamin D. For chronic pelvic pain specifically, 9 of those trials, involving 534 patients, looked directly at the question. Vitamin E, whether taken alone or combined with vitamin C, produced a significant reduction in pain compared to placebo. Patients on vitamin E were roughly 11 times as likely to report a meaningful drop in pain compared to those on placebo, a striking gap for something sold over the counter. Vitamin D told a different story. It nudged pain scores down slightly, but the difference from placebo never reached statistical significance. When it came to painful periods specifically, across 544 women in 9 trials, the results were unusually consistent. All 3 vitamins in every combination tested produced a real reduction in menstrual cramping, with almost no disagreement between studies. Pain during sex turned out to be more complicated. The vitamin E and C combination helped meaningfully, but neither vitamin D nor vitamin E on its own beat placebo for that particular symptom. The blood work backed all of this up with a plausible mechanism. In patients taking vitamin E and C, a marker of oxidative damage called malondialdehyde dropped in direct proportion to the dose and duration of supplementation. Inflammatory markers inside the pelvis, including compounds called RANTS and interleukin-6, dropped too, which is exactly what researchers would expect if reducing oxidative stress is genuinely calming the disease down. The researchers also checked for publication bias, the risk that only positive results get published, using a funnel plot and a statistical test, and found no strong evidence that it had skewed their conclusions. Still, the evidence does have real limits. Most of the trials were small. They used different doses and follow-up periods, and that variation is likely why results swung as much as they did between studies. The overall certainty of the evidence was rated low for chronic pelvic pain and for pain during sex, and only moderate for menstrual cramping, using the standard grade system researchers use to rate confidence in medical evidence. Data on fertility outcomes came from just 2 of the studies and showed no real effect on pregnancy rates, though there were early hints of improved egg and embryo quality that would need much more research to confirm. None of this makes antioxidant vitamins a cure. Endometriosis still has no cure, full stop. But for a disease this painful, this common, and this hard to treat, a cheap vitamin capsule backed by real biological evidence is a genuinely promising place to start. This research comes from Zheng, Chen, Wu, Chen, and Lai, published in Reproductive Biology and Endocrinology in 2023, a systematic review and meta-analysis of 13 randomized controlled trials on antioxidant vitamins for endometriosis pain.